Well, good evening, everyone. Welcome to Bridging the Info Gap, our monthly, or I should say bi-monthly leadership webinar to keep all those who are in leadership positions within the PDA family informed. I'm Ward Blackwell, your executive director and host for this evening, and we appreciate your joining us. Before we get fully underway, we always have a little housekeeping and procedural stuff to cover. First thing, as the nice lady said as we came on the air, if you're an attendee tonight, you will be muted throughout. Those of you who are watching the live stream, you're also muted. You're just watching only. Now, attendees who got the invitation, who are in leadership roles, you will be able to ask questions by typing them into the question box. If you look at the control panel to your right, you'll see several different words. One of them will be questions. Click on the little triangle just to the left of the word questions. It opens up. Type a question in the panel. We allow 10 to 15 minutes at the end of the hour for Q&A. You can type your question anytime before then. We'll get to it at the end of the hour. As always, our presentation tonight is supported by the PDA Member Advantage Program, which is run by PDA subsidiary, Pennsylvania Enterprise Resource Corporation. We wanted to call particular attention to some partner companies that are sponsoring tonight. iCore Connect, which is a silver level partner. iCore is endorsed for encrypted email and HIPAA compliance services. They can do a lot to improve your workflow and protect you from fines or worse. We're also co-sponsored tonight by Payroll Plus, which is as the name suggests, a payroll services company can relieve a lot of administrative burdens. And last but certainly not least, our only so far platinum partner, BestCard for credit card processing services. Their growth has been phenomenal. That's why they are a platinum partner, and that is due to the fantastic service and phenomenal savings. It's now statistically proven that more than $6,000 is the average savings a PDA member experiences when they switch to BestCard. So good companies to check out, as are all the PDA Member Advantage companies. We appreciate their support. Now that we have that out of the way, I'd like to introduce tonight's panel. I'm your moderator. We have with us tonight Dr. Darlene Oleski, who is chair of the PDA Governmental Relations Committee. She's also our ADPAC representatives. Dr. Rich Grossman, PDA President, Dr. Bruce Terry, our representative to CDEL at the ADA, Dr. Jim Tallberg, who represents us on the ADA Council on Governmental Affairs, Vice Chair, I believe, and joining us also from the ADA, John Casper and Janine Pekkanen from the Client Services Department. Welcome to tonight's panel. Now, to kick things off, I'm not actually going to be throwing it to somebody else. I get to have the first presentation of the evening, and I'm going to cover something that you may have heard a little something about already. Since you're in leadership roles, you should have already been given some kind of briefing about PDA's strategic forecasting initiative. ADA had started one a while back. PDA's is kind of similar in a lot of respects, but one thing a lot of people still seem to be puzzled at, what exactly does strategic forecasting mean? What does it do? Well, the definition you see there is kind of at the very core of it. We're trying to identify future trends and align the way we expend our resources and our strategies to make optimal decisions that will bear out well in the future. That means looking at a lot of data. Those forecasts require a lot of analysis, looking at anything we can get our hands on to predict if we do this, what's the likely outcome? If this trend continues, what are the implications? But that allows us to align resources to an overall higher level strategy that is dictated by those most favorable outcomes we can forecast. Now, there's a lot more detail than what I'm going to go into tonight. This is going to be fairly high level that you can find in the handouts. That's also accessible through that panel on your right. You'll see just below the question box, you can click on handouts. There's 5 of them. Some of them will talk about specific duties of various bodies that are within strategic forecasting. One is a very overall framework. But to kind of give you the high level of what the various bodies do, we'll start out with the top the Strategic Forecasting Committee. Now, the Strategic Forecasting Committee is essentially going to be kind of the gatekeeper for all this stuff. They're going to get assignments from the board. They're going to look at a ton of research. It can be in doing environmental scans, member surveys, information they can get from HPI and other places, trying to identify changes in conditions, whether that be in the marketplace, society at large, cultural, political, that can potentially have a material effect, positive or negative, on the association or activities in the profession. And then they'll use the results of all that to assign topical review exercises to what we're going to call Sigma teams, which I'll get to a little bit more in detail in a second. The board of directors will have an opportunity to assign some things to them. They may generate them on their own. They're always going to report back to the board of directors no less than twice per year. But this is kind of where everything gets channeled through that big committee. Now, I mentioned Sigma teams. That's the other key part. Next slide, please. The Sigma teams, which stands for Strategic Idea Generation for Membership Advancement, or Sigma, they're going to take those assignments from the larger committee. They'll develop new ideas to their potential, do some cost-benefit analysis, a lot of different things. Ultimately, though, their objective is trying to conceive new programs or modify existing programs to make PDA as effective as possible based on the forecast of what's likely to happen down the road. There are 4 different Sigma teams. One deals with member services, one with the profession at large, one with governance, and one with what we call enterprise, largely non-dues revenue. Now, how do all these different new parts relate to each other and the existing structure, board of trustees, committees, etc.? This kind of shows the sorts of dialogue and interaction that will be going on between them. You'll have the assignment of issues and reports between the SFC and the board, as I mentioned earlier, all kinds of things going back and forth. But as you can see, it's very interactive. There's not any kind of usurpation of existing roles of existing groups within PDA. It's just a more collaborative effort on all of them, trying to make sure that we funnel everything through these forecasting mechanisms to make sure what we're doing makes the most sense for what we anticipate things to look like 2, 4, 7, 5, 8 years down the road. It's a bit of a cluster of a diagram, I gotta admit. Michelle did a great job trying to make sense of it when I gave it to her. But the main thing I want you to take away is it doesn't work well unless there's support from the existing structure. Next slide, please. And the existing structure still has the board of trustees at the top. The strategic forecasting committees below that. Then if you look on the left side of the screen, that's where all the different Sigma teams are. And each one kind of aligns with some of the existing committees, task forces, advisory groups, etc. There is a very specific reason for the way these are aligned, because those committees that align are the ones that the Sigma teams will draw on for information and resources, and they will also be the ones making recommendations and nominations to actually populate the Sigma team that they relate to. And that's where we're going to get into some of the discussion that's most critical tonight. Next slide, please. It's really critical right now at this point to start getting people in place on the committee, on the Sigma team, so they can get to the important work. The strategic plan that the PDA has been following for the last 4 years, we're at the end of that. We're replacing our old strategic planning process with this. It's time for them to get to work. The Council on Districts has the most to do because this is, in many ways, their primary new responsibility. Strategic forecasting. They've got several people they have to appoint. Priority to get the ones on the strategic forecasting committee so we can have them start work as soon as possible after the Pennsylvania Dental meeting. So the goal is to get those nominations and appointments done by April 20th. Then they've got several people they have to find positions for, or several Sigma teams they have to find people to put into positions That goal is more towards the beginning of June to hopefully get those teams up and running by the summer. Next slide. After the COD, the group with the most priority task, the new dentist committee, because we want to emphasize the involvement of younger dentists in the strategic forecasting process. They'll have a couple of appointments on the SFC itself and several nominations to the Sigma teams. Next slide. District and local societies, they have a role as well. There are opportunities to nominate people you choose to serve on the Sigma teams. Again, we still want to emphasize new dentist and diversity, but you have an opportunity to get people that you want, that you think will be effective. Next slide. All the committees and advisory groups, you go back to that hierarchical organization chart. This is where you fit in primarily, is putting people on to those committees or those teams that align with the role of your committee or advisory group, et cetera. Next slide. And finally, our subsidiaries, PERC, which runs the PDA Member Advantage Program, and the Pennsylvania Dental Foundation, they have a specific role that relates to our enterprise Sigma group, which, as I mentioned before, in many respects, often will boil down to non-dues revenue kind of initiatives. They're looking at PDA as a business enterprise. That's their role. So, a lot of work to be done in a relatively short period of time. For those groups, basically the new dentist committee and the council on districts, they've got some stuff to get done like within the next 3 weeks. But everybody pretty much has something they could be doing to help get this off the ground over the month of May, April and May, really. Hopefully that's kind of giving you a basic idea of what we need to do next to get this going. The handouts will help you understand anything that I didn't cover well that you haven't seen before. And of course, if you have any questions, type them in the question box and I'll try to get to them at the end of the hour. With that, I think I'm probably a little over on my time and I don't want to short anybody else. So I'm going to turn things over to Dr. Oleski, who has a pretty significant governmental relations update for us.
Hi, everyone. Let's get going. So legislatively, my goodness, have we been busy. Virtual credit card. Our House Insurance Committee unanimously voted to move PDA's virtual credit card bill. The bill now goes to appropriations and then on to the full House for a vote. Peg and Bill, who are our lobbyists, are talking to House leaders to get this moving as quickly as possible, and there's a chance that it will really start moving next week when the House is back in session. We're getting the message out to our members about a committee vote, as well as a letter to appropriations and an action alert that all of you may have already seen. So if you've received the action alert, please call your legislator, message them, however you get in touch with them, so that they know that we really would like this legislation to go through. Medical loss ratio. We recently had a meeting with Jonathan Greer, who is of the Insurance Federation, and Kyle Mullins, who's our prime sponsor for the bill, with Peg and Marissa and Ward. And we're discussing what they call the NCOIL model, which is the National Council of Insurance Legislators model for MLR. And that was just finalized at the end of January. So although our original MLR bill was a little mealy and we definitely wanted to change that language, now that NCOIL has gone to make a final version of that language, we want to go with that. So we got word from our insurance lobbyists that, or from the Insurance Federation, that it's probably going to be a tough sell. It won't be as easy of a sell as if we were only looking at reporting, but we want to do what's kind of the movement across the country. And so we're certainly looking at that language, and we'll be continuing to work on that. We're also working on credentialing, believe it or not. We spoke with staff on the Republican side about moving Representative Mentzer's credentialing bill. There's some interest on both sides of the aisle that indicated they wanted to hear from more provider groups. So that's something that we'll be working on, trying to get other agencies to come in with us on this credentialing bill. There's some concern about simultaneously credentialing a provider for all practice locations. There's also some rumbles about the 45-day deadline to credential. So there's things to be worked on, but certainly something that we're working on. Those are probably the top three that we've been hitting hardest, but I want you to understand that we're also still working on teledentistry, which is the House of Representatives passed legislation that defines teledentistry and requires insurance payment for those services with Representative Frankel. There's the restoration of adult Medicaid services and the state budget, which passed a fiscal code that directs the Department of Human Services in coordination with managed care organizations to use $12 million in state funds. Talking about increasing the fees, the reimbursements for 31 specific CDT code numbers. Also, compact legislation we're looking at, and there's a lot of debate on that right now. And a compact is basically establishing a pathway for dentists and dental hygienists in a participating or compact state to obtain a compact privilege or license in another state in which they do not have a license. So there's a lot of discussion. We've had 2 full meetings on that with our GRC team. We've heard from AEDB, we've heard from CSG. So still we're working on that. And most recently we're working on, just today actually, we've been talking about restrictive covenants. And that's very polarizing as well. So we're working hard legislatively for you. Next slide, please. PADPAC. PADPAC, we'd like to welcome Dylan Wyatt to our Government Relations Committee. I just want to let you know who is our current PAC board. It's Dr. Clark, Dr. Gans, and myself, with Marissa Swarney, Dylan Wyatt, and Peg Kuskin, who is our Archer Public Affairs lobbyist. Right now, we're looking at about a $45,000 total hard and soft dollar contribution since November of 2023. And that hard dollar amount is about $26,000. We'd really like to increase that hard dollar amount by about $20,000. I want you to know that we are very dutiful to your money. There is never a time that we just say go, go, go with something without knowing who that legislator is, what have they done for us in the past, where have they been instrumental. And the most important thing is that we want to know that these legislators are on key committees, or specifically legislators that are on committee overlap, so that we're getting kind of the biggest bang for our political buck. And it's all about educating our legislators and making sure that we are in their ear. So please, if you have not contributed to PADPAC, we kindly ask you to do so, to do all of the work that we're doing legislatively and to make that all possible. Next slide, please. And lastly, but not least, this weekend, a whole bunch of us, 56 in total, are heading to Washington on Sunday and Saturday to spend 3 days lobbying and advocating for our profession. The most wonderful thing is we have 37 dental students going from Pitt, Temple, and Penn. So we're actively trying to get our young people involved in the legislative process. We'll have 2 days full of lectures on anything political you can ask for, how to talk to your legislator, how to create a good story. They want to hear our personal stories, personal issues with these bills. And we'll talk about ERISA, lots of things to talk about. But we are advocating for dental workforce, which is one of our legislative options that we will be talking to the legislators about. We will be educating our legislators on the Resident Education Deferred Interest Act, which would potentially allow dentists and medical students to defer payments on their federal student loans until medical or dentistry residency is completed. And also the Dental Loan Repayment Assistance Act, which allows full-time faculty members participating in the Dental Faculty Loan Repayment Program to exclude federal loan repayment assistance from their taxable income. And then last but not least, we're advocating for the Dental and Optometric Care Access Act, which would prohibit dental and vision plans from setting the fees network doctors may charge for services not covered by their insurance. So I know that was a lot of information. I hope you guys all contribute to the PACs so that we can continue to work really hard on all of this. And AdPAC will help with all of our federal bills. PADPAC helps with our state bills. Thank you so much.
Thank you very much, Dr. Oleski. That's a lot to pack into a relatively short report, but you know, things kind of are feast or famine in government relations, and it's good to see us feasting for a change. Dr. Grossman, our president, what have you got for us?
Well, I'll try to make this quick. This is probably my last e-leadership series serving as president of the PDA. Don't all clap. First of all, I want to thank Darlene, who's done a superlative job representing not just us in Harrisburg, but also ADA in Washington. We've been very fortunate to have her, and everybody should really give her a pat on the back. This is, as I said, this is my last leadership series. I want to put a plug in for our PDM meeting, which will be at Mount Airy Lodge on actually the evening of March 18th, where we have a reception that is being given by our ADA trustee, Dr. Jim Boyle. Everybody is welcome. There is no charge to attend. And later on, we're also, that evening, we're going to have axe throwing. Now, some people thought I was going to be the target. I hope you all out there don't feel the same way. But we have some very good speakers. We have about 100 people already registered. So there's plenty of room for more people out there to register and come up to Mount Airy. I think you'll be very surprised on the venue, how nice it is. And in addition, it is a casino for some of you gamblers out there. And there's some very good shopping right up the road. And it's always very nice to be in the Poconos. Anyway, we do have a Board of Trustees meeting. There's really a lot going on that hopefully I can report on at our business meeting and at our town hall. So I don't want to really take up too much time tonight and be redundant. There is one thing, although it's not listed, I serve on the ADA Council of Insurance and Retirement. And as I brought up before we really got the meeting going, I was hoping that Dr. Terry was certainly heavily insured for all his extracurricular activities. But there again, you know, as dentistry has changed and, we are not strictly a male-only profession anymore. There are a lot of our young women dentists who are underinsured. Please take advantage of the ADA programs. Also, the retirement program that's administered by the Equitable makes things much easier to run a retirement program for your dentists, your staff, and you should at least look into it. Maybe it can't compete with what you already are offering your staff, but it never hurts to compare plans. Anyway, I really don't want to take up too much time tonight. It's been a pleasure serving. I think I'm going to miss all the activity, but just as General MacArthur said, old soldiers never die. They just kind of fade away. But I hope to fade very slowly. How's that? Anyway, thank you for your time and your commitment to PDA. Ward?
Thank you very much, Dr. Grossman, for your time and commitment to PDA. And we can make sure you don't fade away too slowly, or too quickly, I should say, more accurately. With that, it's time to move to the ADA portion of the webinar, and we're going to get started there with our CDL rep, Dr. Bruce Terry. Dr. Terry.
Yep, good evening. Ward, you can hear me? Good.
Yes, sir.
All right. First of all, Rich, congratulations on nearly completing your year. And yeah, I will tell you that there will always be work for you to do. So do not worry, okay? All right. So in January, we had our semi-annual CDL meeting in Chicago. And I apologize. Hopefully someone's going to get that in a moment. And at that meeting, we discussed a lot of business that we had going on, and it includes things like the dental compacts that Dr. Oleski was referring to earlier. For those that don't know or are not familiar with this, this is a means by which we'll be able to have, especially our younger dentists, be able to move freely through state to practice dentistry, especially in this new environment where they're working for corporate dentistry, or they have a spouse who's a dentist, or in another type of industry, and they're being moved around. It all started with the military, and the military spouses being displaced and not being able to work. So currently, as of the meeting, there were 3 states that had signed on and had legislation passed, and 12 that were pending. As of today, there are 6 states that have enacted legislation, and there are 11 that are pending. And as Dr. Oleski will know, the challenges are really with the state boards and the state legislatures to pass this. And the state boards have a point of view, and like, a lot of things we've seen in the past, old ways die hard, and new ways are sometimes scary and strange. I think compacts have been used successfully for nurses and in other areas, and I think that it's needed in dentistry, but there are challenges. There are challenges to make it safe and reasonable for dentists and for the states that need to control the licenses of the dentists. So anyway, enough of that. That's still a work in progress. Among other things, we supported a proposed revision to the CODA designation, and we're supporting proposed revisions to the landscape of healthcare delivery centers and to the accreditation standards for basically all programs. That includes advanced education in general dentistry, general practice residencies, public health, endodontics, OMFS, oral pathology and radiology, oral maxillofacial surgery residencies, oral maxillofacial surgery itself, orthodontics and orthopedic residencies, craniofacial special care orthodontics, pediatric dentistry, perio, prosto, dental anesthesiology, oral medicine, oral facial pain. You probably didn't know that there were that many programs, and CODA manages all of those. And so there are going to be revisions made, and you will probably see these as later on this year as a delegate to the ADA. Let's see, there was a request, in case you don't know, there's a bit of duplicity going on between CDEL and the American Dental Association. CDEL has a continuing education committee, and the ADA has a continuing education department. And within the last year or so, it's been suggested that perhaps the CDEL CE committee should be sunsetted and should be now under the auspices of the continuing education department of the ADA. So as a result, there's a pilot program going on right now where the ADA is taking the helm. It's controlling everything that's CE related, and it's reporting monthly to the CDEL committee. And in May, we're going to take a look at the results of that and decide whether or not to move ahead with that on a permanent basis. There was a scoping review on moderate sedation in adults to be conducted and agreed on. And upon the review, it will facilitate a dental anesthesia provider summit as requested by the AAOMS, with the primary objective of updating the ADA guidelines for the use of sedation and general anesthesia by dentists. A few more items that we worked on that we are referring for further study, amendments of the comprehensive policy on dental licensure. The Council considered and approved transmitting a resolution to the 2024 House of Delegates proposing additional amendments to the policy. So look forward to that information, all delegates. In response to a resolution from last year's House, the Dental Education Committee conducted a scan of currently available allied dental career guidance resources, and collaborated with other ADA councils and departments to review the resources and make recommendations on ways to enhance the current offerings, and report its findings for consideration at our next meeting in June for CDEL. Lastly, you may or may not know that there is a problem in getting faculty not just to work in dental schools, but to get them to work in allied health schools as well. And so there has been a faculty shortage in hygiene programs, dental assisting EFTA programs, and even with dental laboratory technicians. So as a result, we are looking at ways to either modify the CODA required ratios, because right now the ratios are problematic, where some of these programs are not in compliance because they don't have enough faculty to students as mandated by CODA. There have been some letters sent by different states contesting and complaining. There has been back and forth between CODA and these different entities, and CDEL has been sort of in the middle of this, but this debate and discussion has gone on. CDEL firmly sees the need to change these standards in order to meet the needs today, to keep the programs open and to keep the students going through the educational process, and not to have programs that have to close because they can't man or they can't staff enough faculty to keep the programs open. That was it. There was a lot more, but it's a 250-page workbook, and you don't need to know everything. So that's my report, and thanks everybody for letting me do this.
Thanks for all the great information, Dr. Terry. And I do think I speak for all the attendees. We're so grateful you did not go through the entire 250 pages. With that, we'll move to our next council report from CGA, Dr. Jim Talberg. I know there's a lot going on.
There is always a lot going on with the advocacy at the ADA. So I'll kind of go through a bunch of quick little hits. So if we can go to the next slide real quickly. I want to thank you all for allowing me to speak tonight from the concept of what the CGA is actually up to. So next slide, please. So here's our quick hits for today, and I'll do these as fast as possible. So the first thing is simply the Medicare update, Medicaid update. These are, of course, federal type policies where the money comes down from the government and then trickles down to both the federal and the state level. On the Medicare side, the biggest issue is that the ADA is monitoring the Center for Medicare and Medicaid Services, or CMS, which is the agency that implements payment and claims processing policies for dental services that are intrinsically linked and substantially related to covered medical services. So what's happening is that they are slowly but surely determining that there are more and more dental services that are integral to the needs of certain medical care, such as organ transplant, cancer therapy, and then certain dental needs through those particular medical cases are going to probably now be covered. The issue is that there's no uniformity as to how they're actually processing the claims. There is a lack of clarity on how to actually enroll in Medicare. In fact, they're actually receiving claims more from the patients than they are from the dentists themselves. So there's a lot more that's going to be coming forward, but there is a certain worry that in the future, if they continue to expand certain services like this through CMS, it could trickle down to a lot more of what we do as dentists. So as a result, we learned that the Council of Dental and Benefit Practice is supporting a work group charged with developing a future state voucher or some type of similar payment model for Medicare, which would be based on the 2020 House of Delegate policy, just in case that Congress decides to throw a full dental benefit on Medicare. So hopefully not, but we'll see what happens. I know that the Council of Government Affairs sent a letter to the Council of Dental Benefit Programs urging that they develop additional policy for the 2024 House of Delegates. And this will probably be really important because it's going to help to broaden veterans' oral health care, which is a often overlooked issue. Under the Medicaid side, the Council of ADA's Medicaid pilot project, I was surprised to find out that Pennsylvania is actually included in a 6-state pilot program. The idea is that they want to create a blueprint and track outcomes by December of 2025 to increase the number of Medicaid providers by somewhere between 5 and 10%. And they want to measure the change in the number of Medicaid beneficiaries receiving dental services, specifically by the category of service. At some point, they're going to be asking for the state dental director, the Medicaid director, the Oral Health Program, Office of Dental Health, Oral Health Coalition, the State Dental Association leadership, Primary Care Association, and some other oral health champions to help advance this effort forward in these identified states. So this is in the very early stages, but it's something that's going to happen, and Pennsylvania is lucky enough to be part of that pilot project. Let's go to ERISA, and actually, you know what, move another slide, and let's see if it goes further here. So another slide, please. And go another one, please. The ERISA. So the magic ERISA, which nobody really knows exactly what it really does and what it really means. It's the Employee Retirement Income Security Act, and its object is to protect interests of workers who participate in some type of employee welfare benefit plan, but that can include not just like benefits and retirements, but also healthcare plans. And what it kind of does is it hides certain things under federal guidelines that some insurance companies will say, well, it doesn't apply to us in your state because you see we're under federal guidelines, because that's ERISA. And so there's all kinds of various issues. It's very complex. I would love to tell you I'm expert at it. I am far from it. There are experts who really will tell you that they're not experts at it. But the bottom line is we're going to try to find out more about how these ERISA plans vary from state laws in regards to things like non-covered services, prompt pay issues, assignment of benefits, etc. Let's go to the next one, please. So workforce and dental team shortages. I think this might be one of the #1 things that dentists in practice believe is so important to us. There's a number of different things that the council is working on. One, a panel with regulators and software vendors to develop data exchange standards. They're working on a toolkit to reduce some of the stigmatizing mental health questions, which you'll see in data exchange standards and in licensure applications. You'll see incentive programs for dental students and professionals to work in underserved areas. They're going to talk about expanding dental assistant programs through community colleges and on-the-job training, along with fast-tracking foreign-trained dentists to work as hygienists until they finish dental school, and using workforce alliances to fund training programs and partially pay salaries during training. There's additional things that they've discussed, things like giving incentives like tuition reimbursement, tax breaks, loan repayment for dentists and hygienists, especially to work in rural areas. And of course, trying to get a better ratio of in-state residents admitted to dental schools. So a lot of different things. They're even talking about maybe having retired military dentists become licensed hygienists in the future. So a lot of different ideas are being passed back and forth. The Council of Government Affairs is going to try to organize perhaps a workforce summit in the future for states to share their best practices and develop new policies to expedite residency status for foreign trained dental professionals. Again, they'll help with the ADA dental toolkit, and certainly as important than anything is working with other councils to prevent and collaborating with other councils to prevent a duplication of effort. Let's move on. Next slide, please. So CGA has several different work groups. These are 2 of them, the Private Insurance Reform Work Group and the Public Insurance Reform Work Group. So the Private Insurance Work Group met and discussed their updates with, again, activities on ERISA. They also talked about the Competitive Health Insurance Reform Act, which was the act that was passed back in 2020. It's the act that actually took away McCarran-Ferguson exemptions for insurance companies and made them more subject to federal antitrust laws. That should be interesting in the future because after this was passed, there's still not been a lot of development pushing and watching these insurance carriers, but I believe more will be on its way. They also got an update on the CDBP activities as to what will move forward with, again, private insurance. As far as the public insurance, they talked about primarily what they would like to do is on children's oral health policies this year, and they want to determine if there's any policy requiring school-age children to have regular dental exams. They're also going to look at how to address inadequate Medicaid dental networks in most states. So they're both very active in trying to get things moving forward in both the public and the private sector. Next slide, please. So AdPAC, and Darlene has already discussed most of this. Just to let you know that your dollars to AdPAC are being used well. 66% of all AdPAC dollars go directly to the candidates to help get them to listen to things. 18% of that, excuse me, an additional 18% went to the grassroots advocacy, which is things that come back down to Pennsylvania and education. So it's really important. Again, they talked about their role in Lobby Day. And then in terms of government and public affairs, the big push was Lobby Day. And one of the reasons that we have so many students, we have over 700 students at Lobby Day this year. It's probably the newest and biggest record we've ever had. But the important part is that student debt is such a major concern. Average debt now actually is around $400,000, just an astronomical number. So the interest that accumulates while these students are in school, it contributes significantly to this kind of debt. So in Lobby Day, as Darlene spoke about earlier, one of the things that we're going to have them maybe put their own spin on things, their own personal experiences, is that opportunity to advocate for bills that address these issues and give students that first experience advocating for what is so important to them, which is their just crazy student debt. Next slide, please. We're almost done. Thank you so much for your interest on all these things, but these all have some interesting comments. The big one, again, is CMS. And again, in 2023 and 2024, they expanded limited dental coverage for patients that are going certain medical procedures. They're still looking at additional ones. But what we really need is dentists to eventually provide input on how to best provide feedback on how to access oral health for Medicare and Medicaid beneficiaries. And more importantly, how to guide our future policies of how to best improve that oral health. Last slide, please. This one has been rather polarizing if you've been on any websites, and that is the NCOIL issue, which is the National Council of Insurance Legislators. So back in January, the National Council of Insurance Legislators met with the ADA along with the National Association of Dental Providers, and they were told by the insurance legislators, you guys, meaning the ADA and the National Association of Dental Providers, you're going to have to work out the deal, and then we'll decide if we're going to do something. And so there were a lot of different issues. You know, there were the issues such as in Massachusetts, where they did a ballot initiative, not a legislative action. Legislative where you got to go back and forth and make compromises. Ballot is either it is or it isn't. And so, as you may recall, in Massachusetts, they did pass the ballot initiative, and that is still being formulated for all the actions that were passed through that initiative. And that was for a rather large MLR or medical loss ratio, in our case, dental loss ratio. The bottom line is that we now have, through what we agreed to do with the National Association of Dental Providers, were more transparency requirements and provisions to investigate and require minimum loss ratios from outlier insurance companies. That means sometimes they would give you 15% on the dollar to go back to dental benefits. Other insurance companies give you 85% of what they took in as insurance money to go back to your dental benefits. So they're really working hard to make sure that we have a really good number. And the NCOIL model now provides a starting point that sets a floor and prevents insurance companies from going lower. That's being debated. Some people thought we should just be at the high level. Other people said we're great where we are as a good negotiating level. It does affect some states who are close to that high level, but there were other states that weren't even close to NCOIL, and Pennsylvania may be one of them, where all they wanted was transparency. And now we have something to say, well, 35 insurers from around the country said, no, you got to do at least this level. So it's a good and a bad, and I'll let you all make that decision for yourselves. But you'll see some interesting comments on social media. The real comment is, I think it was a win because now we have somewhere to actually start from, where in some states it was simply, we're not even going to start at all. So more to discuss, and by the way, in 5 years, they'll talk more about that. Lastly, student loans and the student loan relief bills. Darlene again discussed this, which were the READY Act, the Resident Education Deferred Interest, and the Dental Faculty Loan Repayment Act. So there's a lot of different strategies out there, and the idea is to frame these all issues as workforce issues along with economic issues. That the idea is to, if you give student loan relief, will encourage dentists to practice, and hopefully more practice in underserved areas and specialties that are facing these shortages. That was a lot to talk about. I apologize for going my extra 3 or 4 minutes, but an awful lot in advocacy. The ADA is working hard for you. Thank you.
That is true on multiple levels there, Dr. Talberg, and we definitely appreciate your trying to get all of us very well informed on the just overload of issues. We are running a little low on time, but we're going to do as much as we can to try and still finish at least close to 7:30. But this is a really important presentation we're about to get from our two colleagues at the ADA, Janine Peckerman and John Casper. So I'm going to turn it over to you two without further ado, so we can hopefully not have to make you rush too much.
Perfect. Thank you so much. I'll get kicking off here. So you may or may not have heard that the ADA is piloting a new membership and engagement model framework. There was a note that I saw in the chat about challenges with membership. So the long and short of this is we are challenged with membership across the country. So I don't need to go into all the whys. Happy to discuss that at a different time. But really, this is the solution. You know, one of the ideas or one of the areas we're trying to solve that membership problem. Next slide, please. So there are 3 big areas that we are looking at in regards to this membership model pilot. One is to focus on our exclusive membership, so on our U.S. dentist in a different way. Engagement, how we are going to be engaging our members in a different way, and how we can determine what revenue we can get as members engage with us in different ways. And then finally, the newest one really is customer types, which I'll go into a little bit more. But this is about revenue by offering engagement opportunities to individuals who are not dentists, but see value in joining the ADA or subscribing to things that the ADA may offer. Just stressing it again, this is a group that is not eligible for membership. And now I'll go a little bit into the next slide to a little bit of detail of all of these. So you may or may not be aware, but there's a lot of membership types and a lot of confusion on when one joins the ADA and what membership type and rate they fall into and what their dues are. So the ADA really is looking to simplify into these 3 membership types. One, dental students, which will essentially stay the same as it's always been, and will continue to work with ASDC to collect those dues. 2, the early career group, which are dentists who are out of dental school 1 to 5 years post-grad, who is over the last few years, we have really had a challenge both recruiting, engaging, and retaining. So one of the proposals that we are making for this early career membership type is that we're looking to propose a low flat rate following dental school. Currently, year 1, it will be at $0 dues, which is what we offer now. But instead of doing a prorated or a ascending dues, maybe a 20 to 50 to 75%, we are looking to do a flat rate between years 2 and 5. So one amount, so year 1 would be 0, year 2 through 5 would be a flat rate amount for this early career group. So an opportunity to engage them and at a reasonable price during their early career years as they are getting stable in their new career of being a dentist. And then finally, number 3, dentists who have been out of dental school 6+ years. So overall, the ADA is looking to propose a reduction in membership rate each year for this particular group. Our research and information shows that pricing is a challenge and is an issue. So we are looking to determine a way through both lowering our dues and as well as figuring out new revenue streams to help support allowing us to reduce the membership rate year over year. So this is for, again, the 3 categories for simplification: dental students, early career, and dentists 6+ out of dental school. Next slide, please. So we are now also proposing 2 customer types. Now this is actually brand new to the ADA and will be new to the model. So there's the the individual customer type, right, which is about the non-dentist. So this could be dental team individuals, researchers or scientists who may not be, who are in the dental field but are not dentists. This could be executive directors of nonprofit organizations who focus on oral health initiatives, and as well as international. So this would be non-US licensed dentists and stakeholders living outside of the US who again find value or want to access things that the ADA can provide, but they are not dentists. And again, these individuals would not be voting members, they wouldn't be on councils, they wouldn't be delegates, any of that. This would just be individuals who we would open up access to different ADA services and benefits. And then number two is the customer group. The customer group is the organization access. So this is really focused on the business to business. So what we can do, the work that we can do with dental schools or group practices or international organizations. So this is really, what does the ADA have that an external organization may want to purchase, or a partnership, or figuring out some sort of access that we could work on together. So again, I want to stress that right now, this would be a business to business relationship. The group practices would not be, the group practice relationship would not be individual membership for those dentists within those group practices, but those who work in the group practices would still be able to join under the normal membership rates under the previous slide that I just showed you. So again, membership types and customer types, two different. Next slide, please. So how is this going to look for the membership join and renew journey for launch? So some of you may be aware that in July, the ADA is launching to Salesforce Fontiva, which is going to allow a whole new joining and renewing experience for our members. So the idea is that you log in, you put some personalization inputs on you of what type of dentist you are, what, do you specialize, and what are your other interests. So based on those interests, we would then be able to curate, and you would be able to see these tailorized base benefits to you based on your level of interest based on your level of interest and how you choose to engage. Now, these would be available at an additional price, but these would be personalized benefits that are available to each member dentist on an individual basis. And then finally, you would go to checkout. So as you can see, this join and renew journey for launch is shifting a little bit because the foundation of our system is going to allow us to do a lot more and learn a lot more about our members so we can support them more in a personalized way. Next slide, please. So the engagement loyalty program, I'm not going to talk too much about this because you'll definitely hear about this more later in the year. This is not launching until Q2 of next year, but the ADA is creating an engagement loyalty program. So this is going to be a points program that the ADA is working on where individuals will gain points for how they engage with the ADA. So it could be that you renew at a certain date, you volunteer, you purchase services and benefits or whatever that may be, you will be able to gain points for that at, again, the national, state, and local level is what we're looking to do. So however you engage, you will be able to gain points and then be able to spend those points within the tripartite. So more to come on that, but this is a brand new and really interesting and exciting and different way that we're looking to engage members. And next slide, please. And John, I think this is on to you.
Absolutely. Now, we understand that there are a lot of wheels in motion with the pilot program. So what we've tried to do is break this down as far as what ADA is doing, what pilot states are doing, and then what non-pilot states would be doing. For students, it's very straightforward. This group remains the same with dental students being a direct membership category to the ADA. Next slide. For the early career dentist, ADA is offering that $0 membership rate for the first year out of school with a low flat rate for the following 4 years. Pilot states will do the same with potentially a different low flat rate. Non-pilot states can continue with its current rates or participate in a similar paradigm. Next slide. Now here's an example of the journey that a dentist 2 years post-graduation will be experiencing. Much of this happens on the back end, including the designation of the base member rate. but the member will see one base rate representing all levels of the organization, national, state, and local dues combined. And then they will also see the package offerings. Checkout would include that base rate, including different payment options like monthly or full, plus all the selected packages and the loyalty program offering. Next slide. For dentists 6+ years, ADA will reduce base rates, which reduces that barrier to entry. This reduction in national base dues will happen immediately in pilot states and gradually in the non-pilot states. The pilot states will stabilize or reduce their membership rates. Non-pilot states are being asked to consider stabilizing their dues rates. This is so while we are decreasing our membership dues rates, states don't continue to increase, kind of an imbalance of what we're trying to do by reducing that barrier to entry. Next slide. This is a sample of what a 15-year career dentist journey would look like. Again, much of this happens on the back end, including the designation of that base rate. The member will see their base rate representing all 3 tiers. And checkout would include that base rate, including the different payment options, plus the selected packages and the loyalty program offering. Next slide. Now we start getting into the customer types. Now, as we mentioned previously, the customer types are still a work in progress. There's a lot of diversity in the customer types that would be able to participate, but we've been able to break them down into 2 categories that individual and organization access. ADA and pilot states will have initial access to these groups, except international, which would be ADA only. Next slide. This is a sample of what the individual customer type would see. Designations, again, all made in the back end to make the base rate assignments seamless for the member. Packages would still be options, and the checkout would work very similarly to the way the regular memberships worked. Next slide. This is a sample of what the group customer type subscription journey would look like. Each organization membership can be customized based on the needs of and the value sought by that organization. Agreed upon packages would equal the total price in checkout. Next, I'll pass it back to Janine, who will discuss the governance and implementation timelines.
Yeah, so as you've heard, we are looking to change dues amounts and change and add customer types and simplify our member rates. So how are we going about doing that? So since this is a pilot, the Board of Trustees actually has purview to oversee the pilot. So we will be presenting the full report and parameters to the board in May of 2024, coming up this year. So they will review the parameters that we are suggesting for the pilot and then make their approval at the end of their meeting. Now, as you also heard, we are also planning to try to reduce dues to all dentists across the country. Now, that is required by, needs a House resolution. So we will be sharing that information with the House, per the governance rules and regulations in October of 2024, where they, again, will determine what the active member price for states for dentists across the country will be. So we should have some final determinations about the pilot itself by the end of May, and then move ahead in October for that dues rate request through the House. Next slide, please. And this is just a high-level implementation timeline of everything that's going on that we just talked about. So right now, we are working with pilot states. We have 7 pilot states that we are working with to help them create their packages and figuring out what their dues amounts would be across the board. So that's happening in March and April. In May, we will be going to the board to get the approval for the framework and pilot parameters. In June, we will be finalizing the work at the ADA state and local level for the dues pricing for the add-on packaging. In July, we launched Salesforce Fontiva. And then in August, we will begin to build and integrate the new membership model of everything that we've been working on earlier this year. So that will be built and developed. We will start to market and communicate in September. In October, we will know that final dues amount approved by the House of Delegates. And then in November, we are going to get ready to launch with the renewal season with our new membership model. And then, as I said, with the loyalty program, Q2 of next year is when that plans to be launched and be available to all members across the country. And I know that was a lot and really fast, but Ward, we're going to hand it back to you.
Okay, thank you very much, Janine. I appreciate you getting through a lot in a very short period of time. We're going to try to rush through some Q&A and still in just slightly over. I did get a couple of questions from Dr. Gary Davis related to the discussion about strategic forecasting. Wanted to know what the difference is between the PERC board and the enterprise Sigma team. In essence, PERC still focuses only on the affinity programs, those endorsed vendor program that we call PDA Member Advantage, whereas the enterprise Sigma team will be looking at all sorts of business relationships, partnerships, and other things that the organization might do as a business, which could mean any number of different non-revenue opportunities, not just related to endorsement programs. Another question we had related to strategic forecasting. Let's see, what was, will our committee still have the duty to recommend actions to the board, or will they share their recommended actions to the appropriate Sigma group to send to the board? The short answer is generally committees will still report primarily to the board of directors, but they may be assigned some work by the board, or they may get a request for information from a Sigma team, or the board may, or the strategic forecasting committee may say, we want you, membership committee, to take this thing we got from the member services Sigma team and see if you can't work that into some models that you already have for programs you're working on and combine them in some way and come back with a better recommendation. But the relationship between the committees and the board itself for programs that they come up with on their own or things that they're working on that are still within their purview doesn't really change. It's just they are connected to more different entities within strategic forecasting. Hope that helps answer your question, Dr. Davis. The first question we had relating to the membership model, Dr. Schimmel wants to know, what are state and local packages?
Yeah, sure, I can take that. So the state and local packages are, so these are bundles of offering services or benefits that the state or local can create and put for a price. So when someone would join, they could join and just pay the dues, the dues rate amount. But in addition, they'll also have the option to purchase these optional packages that will be created by the ADA, by the pilot states who are participating. So for example, maybe there's a CE package that a state wants to pull together, or maybe a local is putting together a dinner and meeting package that they want to sell. So the idea is for them that these are optional packages that when they join or renew, they would be able to purchase at an additional cost.
Thank you very much, Janine. Very, very succinct explanation. No other questions on the membership model. A comment though from our trustee, Dr. Boyle, just so there's no confusion, please keep in mind that the ADA HOD must approve any membership model. That simply means that is enacted nationwide. The point,
correct. Yep.
The pilot program is simply a temporary membership model to be used in a handful of states, which may help modify and format a membership model, which would then be presented to the House for everybody.
Yes, so. Wonderful clarification. Thank you, Dr. Boyle.
The only other comments we had, I just for Dr. Lewin, I answered your question about membership in the question box itself, and yeah, nice little shout out from Dr. Davis to Dr. Grossman, thanking you for your excellent leadership during your year. That seems to have covered everything we had. Oh, well, I'm sorry, Dr. Himmelberger asked a question for Dr. Oleski. Aren't compacts enacted by state legislatures, not the state dental boards? Want to take that one, Darlene?
Not really. Isn't that what we were talking about with the attorney checking out all these things? There's a lot of debate on that, and we're having difficulty even navigating that with the help of our legal assistants. So in terms of how it would look or how it would be seen underneath the compact if there was a compact. So that's all TBA, and I'm not prepared to answer anything else on that unless you can pinch hit there, Ward.
Yeah, I think generally speaking, yeah, you can't enact it without legislation, but that still, I think, is not clear where the role of the state board might be in the actual implementation and execution. And that could vary by state. I don't think I have all the information to answer that successfully. We got a couple other, yeah, Dr. Himmelberg clarifies compacts have to be enacted by legislatures. I don't disagree. Dr. Davis has a question for our ADA folks. Would PADPAC and foundation contributions be part of the state options in the new membership model?
That is up to the state. Actually, some of the states are evaluating how an advocacy package could work. So that will definitely be something that we can share with you as those get created.
Thank you, Jeannie. And also a question from Dr. Schuler, what are the states in the pilot program?
Okay, off the top of my head, let's see. Nevada, New Mexico, New Hampshire, DC, New Jersey, Virgin Islands, and one more, John?
Washington.
Washington, yes. Washington State.
So their executive director chair of the task force. So.
He is. Well, and actually Bracken is the one who is who is looking at an advocacy package as well as a life membership package as well. So looking at a little bit differently as far as engagement and recognition for packages as well.
Okay. Terrific. That looks like we have indeed now gotten to all the questions. So we are quite a few bit over. We're going to try to wrap up very shortly here. Thanks everyone for sticking with us this long. Just a reminder for those who didn't get to join us tonight, we do record these webinars and the videos are posted in the PDA video library, accessible by members only on our website. There's a lot of other great content there. I encourage you to visit that and tell other people who might want to hear what was covered tonight to go pick up the recording there and take a look. Hope everybody will join us next time. Remember, this is bi-monthly now, so 6:30 p.m. June 3rd is the next leadership webinar. I'd like to thank our panel again tonight. Dr. Grossman, nice swan song, and look forward to seeing you not right off into the sunset, but finish up a successful term at the PDM in a couple of weeks. All the rest of our panelists, we appreciate it, especially our ADA folks joining us to bring us the breaking news on the membership model. And for all of you who took time out of your evening to join us, we thank you. Hope we'll see you in 2 months and have a good evening.
Thank you all.
Ward, could I say one thing?
Absolutely.
I want to thank my board and the staff. They certainly made this year much easier on me, and I appreciate everybody's hard work. Thank you, and hope you all had a good holiday.
Thank you. And with that, good night, everyone.
Night. Thank you all.